Hi, Phoebe.
Alex?
Hi.
Hi, is your video off?
No, it's on.
Oh, really? I can't see you.
I can't see you now either. You've gone. You were
My
there.
video is off. I can turn it on again. I'm trying to figure out why I can't see you. Strange. Oh, there we go. Okay. Hi.
Hi.
How are you today?
I'm all right. Do I need a tie?
No, I think you're fine.
Okay.
Yeah.
Is the I've got a firm seat this time, and I've put the laptop on some books.
Oh, great. Yeah, the angle looks good. Yeah.
Does it look right? Okay, good.
Yeah. Definitely. So Jeff Schlegel-Melch, he signed on earlier and we checked his audio. Yesterday there was a little bit of a delay because he was using his phone for his audio.
Okay.
But today he's using his computer, so no delay, so that's good.
Okay. Do you want me closer? Is it better like this?
I think whatever's comfortable. If you feel like you're leaning forward a lot, then, I don't want you to be stuck like that for the whole time. But if you're comfortable, yeah, that's good right there.
Okay.
Okay.
Is the angle okay?
Yes. Looks good.
Okay.
So I have to still situate my computer. I'm not where I'm going to be quite. And I'm a little concerned because there's construction outside fairly nearby. Can you hear buzzing?
I can't.
I can't, no.
All right. Let's stop for a moment. All right, well, let me know if you hear something in the next bit. Right now, can you hear it?
Oh yeah, I just heard it a little bit, but it wasn't too bad. As long as you're muted when you're not talking, I think it'll be fine.
Okay.
Sort of a hazard of working from home.
It'll make it very real if I have to pick up my computer and walk to a different location.
Yeah.
Exactly.
Actually, my little off topic, a little off color, my wife shared this video a friend of hers shared where it was a Zoom teleconference going on, lots of people there. And one of the participants, a woman, picked up the computer and she's walking along, and she sits it down and goes to the bathroom in front of it.
No.
Oh my
God.
She just forgot where she was.
Oh my God.
Oh my God.
Oh God. Was she?
Oh, that's so bad.
I think the comments were, you're never going to come out of isolation after that.
No.
Do you need anything
everyone
further
to
from
use
me?
the chat.
Okay.
I have my chat box open and we'll be communicating with you on that during the event. So if we move you to all of you are on screen versus just the speaker, we'll let you know there. And any other announcements that we want to make to you so that we're not speaking over it will be in the chat. So keep it open to the extent that you can, or check it regularly.
I'm also going to send you guys the YouTube link to the video right now, so you can see what it looks like right now. And if you want to check on it during the stream, you can take a look.
Okay.
Just make sure to mute the YouTube because it'll get a little confusing with the audio.
Phoebe, the email invitation that my wife got, which she's signed up, can she just forward that to other members of our family and they can sign up, or is there some restriction? Or
no, they can sign up, and there should be a reminder email going out to everybody at 10:30.
Okay.
With the link to the event, and that's where I'm going to post the YouTube link once we're all on and figured out and Erwin's here. I'm going to ask everyone to mute and then I'll post the link so people can start watching.
Okay.
But yeah, if you share the link now, everyone will hear us talking.
Yeah, okay.
Phoebe, do you need me here longer, or can I go and make myself?
You can go and do your thing.
Okay.
Just I'd say, yeah, just mute and we'll be fine.
Me too.
And we'll see you at 11.
Okay.
Morning. I have you muted. Hold on one sec. Okay.
Hi. Hearing me?
Hi. Yes.
Hi.
How are you?
Oh, good. What's the
Good.
shot? Can you can I see where I am relative to do you see me also?
Yeah, I can see you.
Could I see me for a second? I just want to see where I am.
Yeah, hold on one second.
I hear a sweet voice.
Yeah.
Okay, can you see now?
Yeah.
Mom.
Okay.
Hi.
Hi.
Look, you're on TV.
Hi, what's his name?
Nolan,
Hi, Nolan.
Hi, Nolan.
my other friend from work.
Yeah, I didn't know you're such a big boy, Nolan. All right. So how's the a little dark? Is
Okay,
it?
so it starts at 11, but I'm gonna go ahead and ask you to mute now, and then I'll
So I
share the
don't-
link. What's that?
Okay. So I just leave it like it is. You'll
Yeah,
mute
leave it like it is. I will mute your audio, and then don't unmute yourself until 11 a.m. and Alex will start
Okay.
at 11, and then you can unmute. Okay?
Right. So nothing for me to do until 11. Just come back at 11.
That's right. Yeah, you can just hang out till 11. You can go get a snack or whatever.
Another snack?
That's what I would do.
Thank you.
And Erwin, just to remember when we start to have the chat box open, because that's how Phoebe and I will communicate with you once it's live.
Where's that? again? Where's the chat box? I mean, Allison, where's the?
You should be able to see it if you're on an iPad.
Yeah.
So I'm not sure exactly what it looks like on an iPad, but the chat little icon is a little like speech bubble, and it says
Oh, I see.
chat.
Speech bubble. Speech. I saw that before. I saw it yesterday.
Maybe at the bottom of the screen.
Yeah.
Let's see.
And this more.
Oh, and the more maybe.
Chat.
Yeah, chat. I see it. Okay.
Okay,
So-
great. So just have that open, and I'm going to send you something right now. This is the link to our live stream.
Just right. Hi, Erwin. Is that from
I
yesterday?
did, yep.
Okay.
If we need to tell you anything during the event, we'll tell you
Yeah.
there, so we're not on audio.
All right. So I close it now or leave it open?
You can close it now, but just remember to check it periodically throughout in case there's any important stuff there.
I certainly will. And
Okay,
very good. Thanks, guys.
sure. So I'm going to mute you, and we'll see you at 11. Okay,
Thank you.
great.
Good morning. My name's Alex Halliday. I'm director of the Earth Institute at Columbia University. This is the first in a series of town hall and briefing events that we're going to be doing around the COVID-19 crisis and ways in which the Earth Institute and Columbia University more broadly is engaged with it, and business policy experts to develop solutions and solutions to some of the most profound challenges facing humanity. We focus particularly, of course, on the planet and sustainable, healthy societies. And this is a key issue right now as we work in these extraordinary times. We are continuing our work remotely, and this is being done very effectively, thanks to very strong leadership from Columbia University and full engagement from the university and its academics, researchers, and students and staff who've been amazing at adapting to the situation. My colleagues at the Columbia University Medical Center are themselves deeply engaged, and you'll hear from some of them today, as well as some from the National Center for Disaster Preparedness that's part of the Earth Institute. We see it as part of our role to try and keep the community, the wider community, engaged and to answer some of those questions. So during each town hall, I'll provide a bit of an introduction and talk a little bit about what we're doing, but I'll mainly pass the floor over to three experts who will be talking about their work that relates to COVID-19 in particular. Following that, we will have a discussion. Many of you have contributed questions. We've put those together into certain themes that we realize people want to see answers to. And so I'll be putting those questions to our various participants. Today, we're going to hear from Jeff Shaman, who will speak on the state of the science, his own research work on COVID-19, recently published in Science in particular, and what is known and what is not known. Erwin Redlener will speak to the federal and state local response, including the differences between various kinds of directives, such as social distancing and sheltering in place. And then we've got Jeff Schlegelmach, who will speak about the social elements and the practical guidance for individuals and managers. We're going to begin with Jeff Shaman, who is professor of environmental health sciences at the Columbia Mailman School of Public Health and director of the Climate and Health Program at Columbia University. Over to you, Jeff.
Thank you, Alex, and thank you to you and to the Earth Institute for organizing this event. I'm going to tell you a little bit about, excuse me, the history of this virus as we understand it. We believe the emergence of the virus occurred in November of last year in China, probably somewhere in the area around Wuhan or in Wuhan city itself, with a jump from an animal reservoir to a human host. This is understood on the basis of phylogenetic modeling that uses sequence information to recreate the evolutionary tree of the virus since its emergence as we see it in the human population. And from that, they can back out or infer an estimate of when there was the most recent common ancestor in terms of a single sequence that jumped to humans. It appears, as I said, that took place sometime in November in China. And from there, it sort of moved along and was capable of sustained human-to-human transmission. And it really didn't get into the broader radar in terms of public concern, broadly captured by the media until the new year. At the end of the year, the Chinese government publicly announced that they had a virus, and they felt that they were able to contain it at the time. But within a few weeks, come mid-January, it had already begun to spread to many of the other cities in China, and then it began to hop internationally very, very quickly. The ability to move very quickly made it immediately something of concern to a lot of people in the research community as well as public health organizations. The reality for this virus, unfortunately, is that it has a combination of features that are going to make it very difficult to control and make it very deadly for humans. Those three features are, firstly, that it is an emergent novel pandemic virus, that is, to which most of the population of the planet has no prior exposure. Consequently, we're susceptible to it. Our susceptibility is like the dry tinder to this wildfire that allows it to spread very quickly into communities, because once introduced into a new community, it has an abundance of hosts to infect. The fact that it's a respiratory virus is also complicating to this, because that allows it to transmit in a number of ways that I'll discuss in a moment or two. The second feature that's very challenging, and which was a focus of the research in my group, was that it seems to be supported predominantly in its transmission by silent or stealth transmission. That is, that the majority of people who are infected by this virus only manifest with mild or moderate symptoms. Some may even be asymptomatic. These people with milder symptoms, they don't seek medical attention. They're not going to go to the doctor. They're not going to actually be tested, and they're not going to be confirmed. And as a consequence, we don't actually know where these people are. We haven't identified them, and we can't inform them to isolate themselves and then go after their contacts and have them quarantined as well. Because of this silent transmission, the virus moves very efficiently through the community. When you have a mildly symptomatic illness, maybe you have a sore throat, a light cough, some body aches, most of us will just go about our business. Same thing that we do when we get the common cold on any given winter season. So we're going to go out and about in the community. Maybe we'll take some ibuprofen or some cold medicine, but we're still going to get on public transportation. We're going to go to work. We're going to go shopping. We may even go to restaurants, and we may even go on business trips. Consequently, in doing so, we're taking the virus into the community. We're still shedding it, and we're still contagious, and we can spread it to new locations where, in this case, there are an abundance of susceptible people. We believe that that's really what fostered the rapid spread of this virus geographically, so that now it is inhabiting almost every country in the world. The last ingredient, and the thing that makes this, of course, even more troubling, is the fact that not everybody has a mild or moderate symptomatic reaction to infection with this virus, and that there are a substantial portion of people for whom the symptomatic outcome is much more severe. We're seeing high rates of people actually winding up in the ICU, and there's a substantial case fatality rate amongst those infections that are confirmed or identified, which makes this very, very deadly. The worst case scenario for this virus, if unconstrained, and I want to add here, I'm not trying to fearmonger, but I think it's very important that we look at this clear-eyed to see what the worst case scenario potential of the virus is, so that we can walk back from that and implement measures to control it so that we don't reach those numbers. But the worst case scenario is something on a scale that we haven't seen since 1918, with billions of people on the planet infected. Up to 70% of the population within a year or two could be infected if we don't control this effectively, and a substantial number of people being hospitalized and millions of people even dying, maybe even tens of millions. Again, this is on a scale of disruption that we haven't seen from an infectious pathogen since the 1918 flu pandemic. And certainly within the US, we have not seen this sort of disruption at a national scale since World War II. I want to add a couple things about features of this virus that are important to discuss. One is about how it's transmitted. The virus, you may hear, is transmitted by droplets, and other people are telling you maybe you should wear a mask or you should wash your hands. The reality is that for respiratory viruses in general, we actually don't know how they are transmitted. We can know how they can be transmitted, but we don't know how they are. There are three dominant routes that we're talking about when it comes to a respiratory virus typically. One is droplet, and that is the idea that when you're infectious with this respiratory virus, you shed it in your oral and nasal mucosa. And then as you speak or as you cough, in the case of this virus, which produces cough symptoms, you spray droplets out into the environment. Some of those droplets, if you're in proximity to someone talking to them, you actually may spray them in the face, and they are at risk of acquiring the disease, the infection at that point. So that's a droplet route. And that's the reason why they're telling you to keep your distance from other individuals. The length of distance that a cough can travel, 6 feet, should keep you fairly well protected, provided you are not downwind. The second mode of transmission is indirect, and this involves inanimate objects. When you're speaking, when you're coughing, and even when you're speaking, these droplets that are coming out of an infectious person that have virus in them, some of them are going to be large, and they're going to settle on surfaces. And on those surfaces, the virus may persist. It may remain viable for some time. So if this is a doorknob or a phone or a tabletop or something that people commonly use, even items that you might encounter in the grocery store, for instance, virions or viruses that settle on that may still be viable, may be deposited by one person, and then another person can come along later and pick them up, and by touching their face or eating with their hands, can transfer the virus to themselves and potentially infect themselves. The last mode of transmission is airborne, and that again comes from these cough and droplets that come out from coughing, speaking, or just breathing. That some of those droplets are going to be very small or small enough that they're going to evaporate down to a size where they're going to be aerosolized on the turbulence in the air. They're going to stay aloft for a considerable amount of time. The virus may remain viable in that form. And then, of course, if you breathe it in, you can have it deep in your lungs and it can infect you there. The reality is that we don't know which way is dominant in terms of the transmission of this novel virus. We know that in theory, all three of these are possible. The measures that we really need to take to control them are that we need to wash our hands to control for that indirect route, for touching things, for coming with objects. Try to avoid touching your face and mouth and eyes as much as possible. Wash your hands really well for 30 seconds with soap and water, effectively scrubbing everything. These are important public health measures that you can take that'll personally protect you as well as the population around you from the spread through indirect transmission. For droplets, as I said before, distancing can be very effective as well. If you suspect you're not feeling well, a surgical mask, if you can get a hold of one, is also a good idea to protect the people around you. The more tricky one may be airborne. Certainly we have to go into places like grocery stores or pharmacies that are delivering essential services right now. And in doing so, we may not have control of the environment as we would in our own home. Ventilation may be the key here. Getting these places to open their doors and windows and get the air flowing through there to clear out the air and get any possible infections out of the environment might be an effective way of dealing with that. Now, what we're dealing with here is something called non-pharmaceutical interventions. These are interventions that don't involve a medication or a vaccine. Ideally, we would love to develop something like that. Those come again in two forms. The first would be a therapeutic, some sort of novel therapeutic or something that exists already that we could use off-label to actually treat the symptoms and ameliorate them and prevent fatality and lower the duration of time in hospital or the ICU. The aim here would be to develop a drug, as I said, or to pull one off the shelf and see whether or not through testing, clinical trials, and repeated use, this is an effective therapeutic that we can apply in the treatment of COVID-19. Unfortunately, this is going to take some time to develop. Even the things that are already in existence, such as chloroquine, we've heard a lot about that as this anti-malarial and its possible transfer use for the treatment of COVID-19. It needs to be tested more thoroughly to see whether or not it has the hoped for treatment effects and to determine whether it's safe in the context of a COVID-19 infection. The other thing that we're looking for development for in terms of pharmaceutical interventions is a vaccine. Now, vaccine development for something like flu is something for which we have a template for. In 2009, it was just 5 months between the identification of the virus and the delivery and distribution of an effective vaccine that had been clinically tested and FDA approved in the United States. It's going to take longer, unfortunately, for this novel coronavirus because we don't have the same kind of experience developing vaccines for coronaviruses in general. Consequently, the estimates are that we're probably not going to have a vaccine before summer of 2021. What that leaves us with, in the absence of these pharmaceutical interventions, are the non-pharmaceutical interventions I spoke of. That includes things like social distancing, keeping 6 feet apart, ventilation of indoor spaces so you can get the airflow moving there, washing one's hands. There are also other practices broadly, and those include the things that we see instituted at a public scale, and those include school closings, telecommuting, shutting down of some public transportation perhaps, and isolation and quarantine measures. Isolation is where you identify an infected person and you have them stay home and keep to themselves out of the community in isolation for a period of time until the infection is cleared. Quarantine is where you identify people who have been in contact with an infected person and you ask them to undergo that same period of removal from the broader community so that if they manifest symptoms, they don't spread it into the community as well. Now, I want to talk about a couple last few problematic features associated with this virus. The first is that the measures that we implement today, so for instance, here in New York City and in New York State, on Sunday, they implemented more extreme social distancing, shutting down measures, and bordering almost on a shelter-in-place recommendation in some instances. those measures that were taken in effect on Sunday are not going to be realized. We're not going to see the consequences of them for a week and a half to 2. And the reason for this is there are a lot of baked in delays associated with seeing the outcomes of this infection as it proceeds through the population. Specifically, when a person is infected with this virus, they first undergo what's called a latent period, where they're not even infectious, they're not aware that they have the infectious agent in them, and it lasts for a few days. After that, they may have what's called pre-symptomatic shedding, where they're contagious at this point, but they're actually not showing symptoms. Only after that do some of them, those who develop more severe symptoms, go down the path of having worsening symptoms and eventually seeking clinical care. That usually takes a week, maybe 10 days. The testing and the identification, the confirmation of somebody can take up to an additional 3 days. As a consequence, we're looking at a 10 to 14 day delay between infection and identification for a given individual. Consequently, any control measures that might be enacted today are not going to affect the people who are already infected. They're going to follow that progression. So we're not going to see changes or flattening of the curve until another week and a half or 2 after a particular control measure is applied. I should also add that there are even longer delays when you're looking at what the demand is going to be on hospital beds and ICU beds, which are things that you're going to be hearing about a lot and are very critical. That is even longer because there's an even longer delay after somebody is confirmed before they progress necessarily to needing a hospital bed or needing an ICU bed. Just to give you one quick example, in China, they began implementing control measures in Wuhan, which is the city which was the epicenter of this outbreak, on January 23rd. It was not till 4 weeks later that peak ICU bed demand occurred. So there are considerable lags here, and it's really important that people comply with the social distancing practices that have been applied and be patient to see that the effect of them is actually realized. I'll stop there and I'll pass it on to Erwin now. Thank you very much.
Thanks very much, Jeff. Thank you. That was really fantastic. Looking forward to following up with some questions on some of that later on. I'm now going to hand over to Erwin Redlener. Erwin is director of the National Center for Disaster Preparedness in the Columbia's Earth Institute. He's also a professor of health policy and management at Columbia University and the Mailman School of Public Health. And he's professor of pediatrics at Columbia's Vagelos College of Physicians and Surgeons. Erwin, I know you've been helping the city and state quite a lot. I should say Erwin is being potentially going to be called away by Governor Cuomo and his team. So we'll hope we'll get as much as we can out of him prior to him having to take a phone call potentially. Erwin, over to you.
Thanks a lot, Alex. And the other thing I just want to say that I'm having a little trouble with my power connection on the laptop. So if I disappear precipitously, I'll get back on. But that's where we're going. Anyway, I'm very happy to be part of this panel. I am extremely impressed, as I have been for many years working with the Earth Institute. But at a time of crisis like this, we have the capability of stepping up and bringing a spectacular array of experts to the table as needed from EI itself, of course, and from the Columbia University at large. And Alex, again, thank you for bringing us together. I want to say a few things, and I want to start with the information or news that you've all been hearing, as I have, that the president may want to start reducing restrictions or eliminating restrictions in terms of sheltering in place by the middle of April, specifically by Easter. I just want to say that on behalf of everyone I know in the business, that is literally out of the question. That cannot happen. It should not happen. We actually should be increasing the restrictions for some period of time now, which I don't see as being less than 4 weeks. So even in areas where there seems to be less prevalence of COVID-19, including many rural areas, there are already problems emerging. I spoke a couple of days ago with 25 leaders of rural and urban health centers around the country, and they're experiencing trouble already, and they're in places where access to healthcare may be very limited. So none of us, unfortunately, should count on an early release even for good behavior with this program. It's just, we're just going to be living with this for a while, which suggests a number of things that we have to pay attention to here. The first is that living separated from other people, from loved ones, from friends, etc., other than people in our family unit, is extremely difficult. There's nobody at any level of income or any demographic group that is going to escape this, period. Whether you're parents or whether you're a grandparent or a parent or you living with older people, there are things we're going to have to adapt to. The adaptation process is absolutely critical, and even our own family, I'm sure your families are trying to figure out what that means for people with children in school. Hopefully they're involved now with distance learning. If not, homeschooling is where we need to go. And it's really important for parents to understand their role as buffers from everything that's going on in the world, and being, careful to, I know we're all anxious about this, but as a parent, the more you could, at least when you're dealing with your kids, just kind of put that in the back burner and just help them feel a sense of stability and protection from you as parents could not be more critical right now. There's ways of doing this. We'll be posting some things in our own site shortly about parenting during a pandemic, but it's not easy. And then related to that, of course, is that a lot of people who may or may not have had pre-existing issues with anxiety, depression, and so on, whether those issues do become exacerbated, and people who have not had that kind of history, this is going to be a stressful time. So helping to figure out how you can cope with issues like that is very important. New York State is standing up, has actually already stood up an 800 hotline that people can call and get somebody to talk to and try to figure out methods for getting through all this. My biggest concern at the moment, and obviously we've all been very concerned about the lack of testing. This has been a problem since the beginning. It's inexplicable. At some point there will be a postmortem about what happened, but right now we have other fish to fry. I think serious experts like Jeff Shaman and others who are modelers of disease progression, they're absolutely fantastic, and we're dependent upon them to keep us up to date about what we have and what we can expect. But they do not have, unless Jeff corrects me, crystal balls. In other words, they're very, very talented modelers. I mean, I could barely follow their work, but it's critical to deciding what our policies are. But that said, as Jeff has mentioned, this is a very, very unusual virus. It's a new virus that we haven't been exposed to before. So its actual behavior in real time, in real places, with real people, is a work in progress. But without people like Jeff, I don't know where we would be. But my biggest concern right now is the hospital system. I'm a former pediatric intensive care doctor, and I've two of my kids are in the medical field. And I want to tell you that not too long ago, I was talking about in future tense what is going to happen to the healthcare system. I'm done with that. We are in present tense, a very active, extraordinary, unprecedented crisis in our healthcare and hospital system, which, as I think Jeff indicated, but this is not just a problem of finding space, place, and staff and equipment to take care of very sick patients with COVID, but because of the pressures on our hospitals, people with non-COVID illnesses, chest pain, trauma, strokes, etc., are going to find themselves really in a very unusual situation where care has been reduced because of the overall COVID pressures on the hospital. We are in the full mode of something called crisis standards of care, meaning we are relaxing some of the basic principles that we might have in a hospital. For example, hospital workers needing to change the face mask between each patient and the rest of their protective equipment. That is not possible right now. So my son, who's an ER doctor and one of the big hospitals in New York and a director, is telling his staff when they come in on the beginning of the shift, you put on everything, the gown, mask, gloves, and face shield, and that's it. You don't change for the rest of your shift. And many, many other things. Every single hospital in New York has been asked by the governor to expand ICU beds by 50% or preferably 100%. This means that hospitals are opening up beds, sometimes ICU beds in the cafeterias, in the respiratory therapy, in the physical therapy areas. So we're going to see some very big changes dramatically happening right now. But I think trying to stay out of the hospital unless it's absolutely necessary is really important. Unless, of course, you have a serious medical condition, you need to go, and then you need to go. The other point I wanted to make is that what we are seeing right now with New York and maybe New Orleans being a so-called epicenter, that's a work in progress. That epicenter will probably change. It's not going to go away in New York anytime soon, but it's also going to be popping up with more or less severity in many other places. What I really worry about, and this is of interest to many of us at the Earth Institute, who work on sustainable development, economic development in poor nations and other issues, we haven't begun to see the true impact of this pandemic in places like Africa and other parts of Southeast Asia and South Asia. So we already have seen it obviously in China and South Korea, but the worst is yet to come for places like the entire continent of Africa. And this means that countries that are struggling, that do not have the kind of robust healthcare systems that we might see in the West, which are already experiencing great difficulty, in places where those kinds of systems are not available, it's going to be a real problem, which is one of the reasons that the expertise at places like the Earth Institute in our intimate work with sustainable development and helping countries move up the economic ladder is all going to potentially be interfered with by this horrendous pandemic. And I feel like this is something, as Jeff has said, just what feels like years ago, but it's actually a week or so ago when we were comparing what we're dealing with now to the SARS epidemic of 2003 or MERS or the swine flu in 2009. Those comparisons are not appropriate. We're really talking about a benchmark of the Spanish flu of 1918. By the way, an ill-named epidemic. It had nothing to do with Spain. Probably started somewhere else, but Spain was the first to report it. But the problem is here that we're going to have 150 to 215 or so million Americans who contract the virus. And because the numbers are going to be large, even though the actual fatality rate might be low, it still could amount to at least 500,000 deaths in the US, maybe as many as 2 to 2.5 million deaths in the United States. And what's going to drive the outcome here and make it better or worse is going to be the only thing we have, which is severe restrictions of movement and congregation. The crowd size people should be aiming for right now is 2, unless there are people that live in your own household. And we need to keep that social separation, as both Jeffs are going to talk about, could not be more critical. And there's an interesting phenomenon here, which is that the government cannot do all this. It can close bars and restaurants, but supermarkets and drugstores will be open for the duration. Some grocery store managers, aware of their responsibility, are only allowing a certain number of people in at any given time into the grocery store, or the pharmacy, or whatever. Others we see, packed stores, long lines, etc. And I think it's a time for any of you who have any influence on your local grocery stores or pharmacies, tell them this is not okay if they're not controlling. My wife could not get into our local Dwayne Reed the other night until somebody left the store. So that kind of control, and even keeping the 6 feet distance inside the store is also important. Let me leave with something about your own general health. I talked about the mental health issues, and you need to really take care of that. We also can't neglect our general health at a time like this. The healthier we are, the less likely we are to get sick. And if we do get sick, many people feel that being healthy, fit, etc., is going to help one get through this. So that means if you're not going, first of all, if you can go outside, you just have to keep that separation distance. So if you want to walk, that's fine. If you can't go outside for whatever reason, do whatever you can in your house to keep up some daily routine of exercising and interacting and reading, and a normal type of schedule that's good for mental and physical health. I had an email from a friend of mine who's a podiatrist, foot doctor, yesterday, saying that foot health is particularly important. Oops, sorry, my iPad took a dive. I'm just gonna get this straight now. Sorry. Anyway, so my friend, the podiatrist, said that foot health is really important because we want people to walk. And in fact, since we'll be taking we're taking fewer and fewer rides on subways and buses, walking may be our main mode of getting around for a while. So make sure your feet are healthy. I promised Rock Positano I would deliver that message. And so that's it. Just try to stay healthy, be aware of your mental health, be aware of your parenting responsibilities, and be well. I wish all of you well. And remember, the vast majority of us will get the virus, have very few symptoms or mild or moderate symptoms, which we can take care of symptomatically at home until we get better information. I just want to say, literally the final point is, the president wants to reassure us and wants to get businesses open. I don't know all of his motivations, but really pay attention to the CDC websites and local Department of Health and to experts. That's what I'd like to leave with, Alex.
That's great. Thank you very much, Erwin. And certainly we believe in experts, which is one of the reasons why Columbia University is here to connect with everybody today. And we have some great experts here. I'm going to hand over to the third one of those right now, Jeff Schlegelmich, who's the Deputy Director of the National Center for Disaster Preparedness at Columbia's Earth Institute. Jeff, over to you.
Thank you, Alex, and thank you to my colleagues for the opportunity to speak with all of you, and to all of you for joining and being engaged with this really, it seems you can't get away from it, but to try and really kind of ground ourselves in the latest and best available science. So I'm going to talk a little bit about kind of the social impacts, some of the things we're seeing in the legislation, and revisit a few things that I think Erwin hit on as well. So the first is that, in order to address the public health issue and these clinical issues, we're also creating a number of social issues, right? That it's this secondary disaster of the slowdown in the economy, the slowdown in the wages, and everybody's sort of adjusting to this new normal. So the first thing I'd mention is that, social distancing, of course, has downsides, which my colleagues have spoken somewhat to already. Just looking after normal disasters, if there is such a thing, hurricanes, tornadoes, things like that, small businesses are much more vulnerable than large businesses. They don't have the same level of continuity of operations planning. They don't have access to the same lines of credit and cash reserves and things. And following a disaster, 90% of smaller businesses that don't reopen within 5 days fail within the first year. So it can really be a death sentence to small businesses. The other is that, as we've seen, although savings has gradually gotten a little bit better among the United States, about 40% of Americans don't have the cash reserves to pay for an unexpected expense of $400 or more. So these are two sort of underlying dynamics as we look at weeks at a time, and perhaps even months of some of these social distancing measures. These are particularly vulnerable households and particularly vulnerable businesses. CUNY, the City University of New York Graduate School of Public Health and Health Policy, is doing a tracking survey looking at the impacts in New York. And, it's hard to imagine. It's really been a relatively short period of time that we've been under this new normal. But even in this very short period of time, nearly a third, 29% of New York City households report at least one person losing a job. And this is disproportionate. This is much higher among those who don't have a college degree, and is much higher among those making less than $50,000 a year. It's also very disproportionately affecting the Latinx and Hispanic community, with about 41% reporting loss of a job and at least one person in their household. So when we look at this, I think it's important to think, within our communities, some of us are in different positions than others in terms of how we can reach out and how we can help. A little bit of a silver lining. I know a lot of folks have been anxiously awaiting to see what's going to be in this stimulus package coming out of Congress. The latest package, the latest deal is coming out of the Senate, hopefully for a voice vote with the House tomorrow, and to be signed ideally before the weekend. The latest is about $2 trillion. I'll give you a couple of highlights, but also to keep tracking this, because of course the devil is always in the details. But it looks like about $500 billion, that's $500 billion for distressed companies. A lot of this is backstopping federal loans to these companies, so essentially providing the collateral for that. But there are also some grants for wage losses and things like that for the airline industry, among others that have been disproportionately affected by this. About 350 billion with a B for small business loans. So as
hey everyone, can I actually interrupt for a sec? I think we might have lost our stream momentarily.
Okay.
So might want to pause while I just figure this out. Really sorry about that.
No problem.
Just hang on and I'll let you know when we're back on.